Whole grains contain bran, germ, and endosperm in their original proportions. However, in refined grains, these bran and germ are stripped away. So when going shopping, you should look for the word whole, either whole grain or whole wheat. Also make sure the grain is one of the first 3 ingredients listed on the label. A whole grain stamp from the whole wheat console indicates there's at least half a serving of whole grain inside. And don't be fooled by bread that looks healthy because it's brown. It may just be colored with molasses or brown sugar. This video presents 10 reasons why you should add whole grains into your daily meal. 1. Packed with fiber. Whole grains are super rich in fiber, which adults need about 25 to 35 grams daily. They contain both soluble and insoluble fiber, which are both beneficial to your body. You'll get 5.8 grams of fiber in 2 slices of dark rye bread, but only 1.9 grams from the same amount of white bread. And you'll get 5.5 grams of fiber per 1/2 cup uncooked brown rice compared to 2 grams in uncooked white rice, which is not a whole grain. And only 0.7 in a serving of instant rice. Because it digests slowly, fiber also helps you feel fuller longer. And fiber's health benefits are well known. It can help control blood sugar, lower LDL or bad cholesterol, and reduce colon cancer risk. Not all whole grains are high in fiber, though. Focus on oats, barley, and bulgur, says Delbridge. 2. Lower blood pressure. Besides controlling cholesterol and reducing triglycerides, they also lower blood pressure, one of the most important risk factors for heart disease. One study found that 19% lower risk of hypertension among men who ate more than 7 servings of whole grain breakfast cereal a week, compared to those who ate 1 or less. A study of women also found a benefit. Eating whole grains instead of refined grains substantially lowers blood cholesterol, triglycerides, blood pressure, and insulin levels, says Chang. Any of these changes would be expected to reduce the risk of heart disease. 3. Control cholesterol levels. Eating whole grains helps reduce the risk of heart disease as they refrain your body from absorbing bad cholesterol and lower triglycerides. In fact, whole grains lower the risk of heart disease overall. One study found that women who ate 2 to 3 servings of whole grain products daily were 30% less likely to have a heart attack or die from heart disease compared with women who ate less than 1 serving a week. Any form of whole grain, including whole wheat, oats, brown rice, barley, corn, quinoa, rye, buckwheat, and millet, will confer benefits for heart health, says Chang. When it comes to oatmeal, steel cut is better than instant. 4. Boost digestion. Whole grains are beneficial to your digestive system because their fiber content keeps bowel movements regular. And they help ward off diverticulosis, a condition in which small pouches form in the colon wall, causing inflammation, constipation, diarrhea, and pain. Fiber is responsible for much of the benefit. But whole grains also contain lactic acid, which promotes good bacteria in the large intestine. These organisms aid digestion, promote better nutrition absorption, and may even beef up the body's immune system. 5. Aid in controlling weight. A study found that people who eat whole grains are more likely to keep their body in shape and less likely to gain weight over time than those who eat refined grains. In another study, women who consumed the most wheat germ, brown rice, dark bread, popcorn, and other whole grains have a 49% lower risk of major weight gain over time compared with women who favored donuts and white bread. Over the span of 12 years, middle-aged men and women who ate a diet high in fiber gained 3.35 pounds less than those who went for refined products. 6. Contains calcium. Although whole grains are not a rich source of calcium, one grain, a form called teff that is common in Ethiopia, does provide some calcium. 1 cup of cooked teff is about 123 milligrams of calcium, similar to a half cup of cooked spinach. Also look for calcium in broccoli, milk, yogurt, and cheese, and in fortified juices and cereals. Adult men and women should get about 1,000 milligrams of calcium a day, according to the National Institute of Health. Calcium is important for bone health. 7. Refrain you from overeating. Consuming whole grains make you feel fuller than refined grains, such as cookies or white bread. The author of The Small Change Diet, Dr. Gens, says that whole grains take longer to digest and have a more satiating effect. This could also help keep your portions under control. Try rye or protein-packed quinoa to get maximum fullness. 8. Regulate blood sugar. In comparison to refined grains, whole grains prevent your blood glucose from spiking and reduce the risk of type 2 diabetes. Women in one study who ate 2 to 3 servings of whole grains a day had a 30% lower risk of diabetes than women who ate little or no whole grain products. One analysis found a 32% lower risk of diabetes in people who ate 3 or more servings a day of whole grains versus a 5% risk reduction in those who ate refined grains. Something as simple as swapping 1/3 of a serving of cooked white rice a day, about 2 ounces, for brown rice was associated with a 16% decline in type 2 diabetes risk. Eating whole grains has been proven to have a protective effect against type 2 diabetes, so they are a smart choice for people with pre-diabetes or high risk of diabetes, says Cheng. 9. Full of B vitamins. Whole grains are packed with the B vitamins including thiamine, riboflavin, and niacin, all of which are involved with metabolism. They also contain folate, folic acid, which helps the body form red blood cells and is critical for preventing birth defects in babies. Whole grains can help, but women who are pregnant or thinking about getting pregnant need to take a multivitamin with 400 micrograms of folic acid a day. Bran is one good source of B vitamins, says Delbridge, who holds an adjunct faculty position at Arizona State University. 10. Redistribute fat. Although you may not lose weight by eating whole grains, studies have shown that it can help you reduce body fat and redistribute it healthily. Specifically, eating whole grains can leave you with less belly fat, which scientists kindly call central adiposity, which increases your risk of diabetes and other health woes. What do you know about the benefits of whole grains? Please share in the comment. Thank you for watching, and don't forget to check out our other videos.